Good morning, everyone. We're excited today. We have Phil Ellis with LifeLine Pilots, and we have a really great presentation for you today. And so I'm going to introduce Phil. He is the outreach coordinator for LifeLine Pilots. And prior to that, he enjoyed a 34-year career in healthcare, most recently as the network director at the Indiana Rural Health Association, where he managed a network of 28 rural hospitals in Indiana. Phil is the past president of the National Cooperative of Healthcare Networks Association and past president 2 terms of the Indiana Medical Group Managers Association. He spent many years teaching as adjunct faculty at multiple universities. Phil graduated magna cum laude from Indiana Wesleyan University, where he earned his BS and MBA. He received a second MBA from the School of Business at Rutgers University. Having recently retired, Phil and his wife Kathy enjoy playing golf, attending classical musical performances around the nation, and hiking with their dog. Is it Sev?
Sassy.
Sevi. That is awesome. I love it. Well, we're really excited to have you with us today, and I am going to turn the floor over to you.
Well, thank you very much, Cindy. It's a pleasure to be here. I appreciate you giving me time to speak with your chamber members. And as you said, I am a coordinator with Lifeline Pilots, who are based in Peoria, Illinois. We cover 10 states around the Midwest and Great Lakes area. So my contact information is on the screen. Cindy can provide that for anyone afterwards. If you have questions, I'll be more than happy to speak with any chamber member about our organization. So as Cindy alluded to, I've just recently retired after 34 years in healthcare. I worked with many physicians throughout a lot of change and frustration, as I'm sure you've all experienced with the healthcare industry. In the 90s, I worked with physicians in hospitals as they launched the beginnings of electronic medical records. I worked with physicians in hospitals through the major hospital acquisition programs that began in the early 2000s. We realized how many hospitals have been acquired by a larger network. So I worked through all the frustrations of that with hospitals and physician practices. And as Cindy said, I managed a network of 28 rural hospitals. The toughest times for them certainly were going through the pandemic, were some very dark days in healthcare. But at the highest source of frustration in my entire 34 years of healthcare was the ongoing and continually deteriorating loss of access to care for people who need it. So I met Lifeline Pilots back in 2018 as I was the network director for a 28-member hospital network. My primary function was to bring the most valuable resources possible to rural hospitals. They lack the resources of large urban hospitals, and so my primary role was get every business resource or clinical resource I could to help those rural hospitals bring the best medical services to rural and suburban communities as possible. So I came across the people at Lifeline Pilots, and over my 34 years, I have interacted with countless, hundreds and hundreds of different business organizations that serve providers in one way or another. None of them stood out to me the way Lifeline Pilots did. Upon hearing about their mission, what they do, how they accomplish it, I immediately got them involved with my hospital network, brought them in to meet our hospitals, and it began a wonderful relationship where patients in anywhere in rural Indiana were able to get free medical air transportation to places like the Mayo Clinic or Cleveland Clinic or MD Anderson. So I just developed a wonderful relationship with Lifeline Pilots. And when I announced my retirement in January of 2025, the people at Lifeline Pilots came to me and said, "Hey, when you retire, can you do some work with us? Because you're such a strong advocate. We'd love to have you with us." And so although I was looking forward to retirement, that was one I could not turn down. So why am I here today? Well, to be frank and honest, I have a high regard for the role of local chambers and what they do. I think they are the greatest repository of local resource knowledge in any community. The members are connected through the people they work with in their community uh, at a rate that no other organization can do. So for me and my efforts to reach out to a community and try to get this information in front of people, I'm not selling anything. I'm merely trying to spread the word. For me to do that, I realized that the best possible way for me to get connected would be through the local chambers. And I reached out to Cindy, and she was kind enough to respond and say, "Why don't you come back and speak with all of us?" Chambers are able to connect patients, and in smaller communities, this is a very uncommon need. So getting that information in front of someone and having them remember it is a challenge. But if local chambers are aware of this, then when someone who might be a customer or a neighbor or a friend is faced with a requirement of seeking health care at a distant location, they'll be able to say, "Hey, I know of an organization that I can put you in contact with." And that's just another myriad ways of chambers connecting with their community and bringing services to their community. It's not just a business resource that they're bringing, it is a life sustaining resource. And so that's why I'm here today, is to be able to connect with chamber members, because I know how important you are to your community. So LifeLine Pilots began in 1981 by Wanda Whitsett. She and her husband owned their own aircraft and lived in Peoria, and she heard of someone in her community that needed to be seen at Mayo Clinic but had no way of being able to get there. And Wanda said, I'm retired, I can do that. And so she flew the patient to Minneapolis. She and her husband flew them there and then waited until they were done and then brought them back. And so she got to talking to some colleagues and friends of hers, and they were saying, "Hey, we heard what you did. That's pretty cool." And so their discussion just kind of one thing led to another. So other pilot friends of hers said, "Well, why don't we start an organization? And when we hear of needs, we'll take turns and we'll fly people to where they need to go." And that was really how Lifeline Pilots began. So I want you to imagine for a moment a situation where you have a physician visit, or with a spouse or with a child, and you receive the unfortunate news that you have a very rare illness and that you need to be seen at Cleveland Clinic, Mayo Clinic, MD Anderson, or Johns Hopkins University. And you're faced with this for something that is the first time in your life you've ever dealt with something like this. Your mind instantly starts trying to process everything that you're going to endure as you navigate this challenge. You start to think about time off of work, potential loss of pay, potential loss of a job. How will you coordinate the appointments? How will you deal with all of this? Scheduling medical appointments, especially with a specialist. This isn't just a routine family practice visit you're about to endure. This is scheduling with a specialist, and those appointments can be 2 and 3 months out because they are specialists and there's just not very many of them. The affordability of this type of healthcare is a daunting thing that disturbs people greatly when they're focused on this. And unfortunately, we have a very struggling healthcare system in our country. Access to care is an enormous problem. The battles we face with insurance, getting things approved, is a nonstop hassle. So you've now faced this situation, and then suddenly you start to think about the airlines, and you think about the process of making reservations and getting booked and dealing with getting to an airport and all of the inconveniences of commercial travel. Not to mention that airports and airplanes are the single highest source of germs, and the patient is already facing an illness. The last thing they need to be is confronted with this. The cost of air travel starts, you start thinking about that. When you're referred to a specialty care facility, it's not a one and done. It is an initial visit where you are diagnosed, where they prepare a treatment plan, and then it's multiple trips back to MD Anderson in Houston, or multiple trips to Cleveland Clinic, or wherever your destination is. So your mind starts racing and thinking about, oh my gosh, how am I going to afford these travel costs? And that's where Lifeline Pilots comes in. We fly patients who are in need through a network of volunteer pilots. We currently have over 350 pilots, and we fly non-emergency patients who have been referred by a physician to the destination where they need to be seen. We cover the 10 states in the Great Lakes Midwest area. We partner with Angel Flight East and Angel Flight West for further destinations. So one of our most frequent destination is MD Anderson in Houston. It is one of the better cancer treatment centers in the nation, and a lot of physicians will refer patients there for specialty cancer needs. We had one patient that we flew 166 times. Unfortunately, she finally passed, but we flew her there 166 times. And we do that by partnering with Angel Flight West. So this patient was in Southern Illinois, so the pilots there would pick her up. They would get her to Southwest Arkansas, where we would have an intercept pilot with Angel Flight West would pick her up and get her to Houston, and then we coordinate the return flight as well. So we can go to Johns Hopkins University, on the East Coast, we go West Coast, anywhere we need to be. We also do humanitarian flights in addition to the strictly medical flights. Several things that would come to mind would be the trips we've made to Katrina or to New Orleans after Katrina hit. We flew supplies there. We flew supplies to the hospital in Joplin, Missouri, when that hospital was completely wiped out by a tornado. We flew supplies to hospitals all over the country during pandemic when we needed masks and all type of PPE equipment. So 20% of our flights are humanitarian. And I'll go back to my imagine if. So you're a parent and you've got an adult child who are adults kids who are at college out of state or traveling out of state and they're suddenly hospitalized. As a parent, imagine being stranded, not being able to be there, not knowing what's going on. So these are the type humanitarian flights that we do as well. So the people that we help, our primary target, 80% of our flights are for patients seeking direct medical care or care. They are people who live in rural or sometimes suburban communities. It's for anyone who has a transportation barrier for non-emergency health care. It's for people whose health restricts them from being on a commercial airline. A physician will say, you really need to be seen at Mayo Clinic. I'm concerned about you being on a commercial flight. We're at the height of an epidemic flu season right now, like we've not seen in decades. So your chances of infection are even higher. We help people who are on limited income or facing a financial burden. We don't ask for tax records. We don't ask people for documentation. We say for the record that we are for people who have financial need. But let's face it, if I am about to engage with a distant hospital, as I said, that's not a one and done. That is multiple trips. They'll have hotel costs and everything else. So in reality, anyone facing this is going to have a financial need. So that's who we fly. Requirements for our um, patients is that they must have a financial or compelling need. They have to be able to set up right to get into these aircraft. These are single and twin engine aircraft. They must be ambulatory, meaning they have to be able to walk. So when they go to a regional airport, they pull in, they've got to be able to walk to get out to the aircraft. These airports, they're not like the commercial larger city airports where they have gates and terminals. These are, you would pull up and then just have to walk a short distance out to the aircraft that's waiting for you. They can take caregivers with them as well. Most of these aircraft will seat 4 people, including the pilot. So you have the pilot, the patient, and when it's children, we can take both parents with us. So people say all the time when we talk about this, the first question that I'm always faced with is, so who's paying for all this? I think that's people just really struggle with that concept. And so my primary response is this is done through volunteer pilots. These are individuals who own their own aircraft and they just want to be able to give back. So they donate their time, they donate the use of their aircraft, they pay the fuel, they pay for any gate fees or landing fees or anything that there are. at airport. And so they donate their resources and talents to help fulfill the needs. So that's where the majority of our funding comes from. We have strategic goals. So going back to 2022, our goal was 575 flights. We did 641. 2023, our goal was up to 700. We did 928. By 24, we were doing 1,100 flights. By 25, 1,300 flights. And then our goal for 2026 will be 1,600 flights. We guarantee passengers that they will not be stranded. So going back to 1981, we've only had two situations which were triggered by weather where we were unable to get a patient out when they were done and needed to come home. Smaller aircraft fly at lower altitudes, so they're at higher risk of storms. We guarantee patients will get them back. So if our pilots aren't able to get them returned on the date they need to be, we will pay for them to be on a commercial aircraft and get them home. So we're not going to leave anyone stranded. So every flight is free. The stories I hear from pilots, the testimonials that we see from patients, if you want to have something that brightens your day every day, then follow us on Facebook, because almost every day we have postings where families want to post something. They share their story, and it is a tremendous way to start your day. Life gets frustrating, daily routines, business frustrations, etc., pile up. But when you see the impact of families who could not have gotten somewhere without this type of help, it is an amazing thing to experience. I hear story after story from pilots and passengers who will say, you've got a 9 or a 10-year-old, they're old enough to know that they're sick and that this is serious because they have to go somewhere. And so our pilots just give them a few hours of relief. They make them feel special. And they will say, "Hey, Dad, why don't you go sit in the back seat and let Sally come up here and sit in the front seat and help me fly this plane." And so for the kids, it's an uplifting moment and an opportunity for them to kind of separate from what their experience really is. It makes them feel special because they are, but it is something that can be a huge help to what's going on for those kids. So I mentioned that our pilots donate their time and use of their resource, and that provides 85% of all of our needs. The rest of it just comes from donations. We have a lot of corporations and organizations that value what we do, and so they make up the difference between the cost that we have for operating expenses. So to help other people, we have to have help as well. As I said, I'm not selling anything. I'm merely trying to get this resource out. I'm trying to get the word out, because this is usually a very uncommon resource. It's hard to get this as something that's not an everyday use, so it's hard for people to remember this. But that's why I wanted to reach out to Chambers so that you are aware of it, so that when that need comes, you can help your members and their families. So that's why I'm with you today, is just to tell you about the organization and what we do. And one last thing, we're also recruiting pilots. We have a greater need for pilots as the number of flights we do increases because of wonderful people like you who tell people about us when they're in need. We also need more pilots. More flights means we need more pilots. So if you know of any pilots who own their own aircraft and want to be a part of this, we have, like I said, about 350 pilots now. They have a very unique relationship among pilots. They have a shared passion to fly. Most of them tend to be very generous and giving people. They want to give back to their communities. So we're always in need of pilots. So keep that in mind if you know of anyone. There's our contact and our social media information. And I strongly urge you to just follow us on Facebook. You will get a daily lift that is just really encouraging. Just a quick story. I was just telling Cindy this morning, I met on Tuesday with a lady who was an airport manager at a regional airport in Kentucky. She called me back the day after and said, literally an hour after we spoke, I received a call from someone in our community whose wife was just diagnosed with cancer and has to be seen at Mayo Clinic. And he asked me if I knew of any air services that could help get them there. And she said, I literally just an hour ago got off the phone with LifeLine Pilots. And so we've already connected with them. They have our information. And that's just one more life that we'll be able to impact. And so your knowledge of us can be the difference between a successful treatment and impact on a patient's life. So I ask that you would just share our information with anyone that asks, and I'm more than happy to take questions at this point.
What a great tool. This is just, it's wonderful to be able to share this. And I think that in sharing this, I think it definitely sheds light on what it is that you do. And I think it will be very useful, very helpful for chambers. I also wanted to bring up at lifelinepilots.org, which has been on every one of your slides, which we will share. If you go to that website and just kind of look around, you will see, there's the stories, all of that. Again, follow all their social media, but there's also a store there that you can actually go on and purchase all kinds of different things that you can have. And, all those things also support the things that are going on. I actually went on, I purchased a few things. So I have a journal that I use. And so there's all kinds of ways that you can to go on and support. So and
Yes.
again, even just spreading the word. And I think that's going to be the key here. So I'm really
That is
excited.
essential.
So
Thank
yeah,
you for that,
so
Cindy.
yeah,
I
absolutely.
appreciate that.
So, you and I were talking earlier that, you will be, available to even help with chambers to, for them individually
Yes.
with chambers, even if chambers have things that they might do together, in
Yes.
ways that you can help spread the word too. So I wanted to make sure I mentioned that too.
Absolutely. I'd be available at any time. Just send me an email or reach out and call. I'll be more glad to help any chamber. Ohio is a state that people think of Ohio and they think big cities, Cleveland, Cincinnati, Columbus, Toledo, Dayton. But the majority of the state is rural. There are a lot of rural communities between those cities, and people need help. And that's where we specialize in those regional airports. So, yes, Cassie, a question?
Nope, I think she's frozen.
Oh, I believe
Oh,
she is.
are you there?
There she is.
Yes, there
Yes.
she is.
Yeah, Cassie.
Wyandotte County, we have 22,000 people. That's it. So,
Good.
and he just fixed the airport. We got a new beacon.
Great. Airports that we can serve, the only requirements is that they have a paved runway
Yep.
of 3,000 feet in length and 65 feet in width, which just about any regional or county airport will have that. But
well, we're up to code now. We just got up
great.
to code, so we're good.
Excellent. Yeah, I mean, imagine the difference of having to go to, and Cleveland Hopkins is a fine airport, but having to navigate that entire issue, trying to get in or out of there, or Columbus, or
Well,
Covington in
and
Cincinnati, those are big
Cleveland is
airports.
3 hours away from here.
Yes,
So if to go to the Cleveland Clinic, it takes literally 3 hours because I've
yes,
gone there to visit people, and it's a long ways away.
it is. Our flights, we have a minimum of 100 miles and a maximum of 1,000 miles from the point of departure, because it's not efficient to use an aircraft for less than 100 miles, and we'll go up to 1,000. For patients who need to go to Mayo Clinic, for example, if they're coming from Cindy's area or even further northeastern Ohio, we stay over land. These are smaller aircraft that fly at lower altitudes. So our pilots do not fly over the Great Lakes, they fly around them. So flight might be a little bit longer, but we're going to play it safe. And in case there's inclement weather, they want to be able to set their aircraft down somewhere, and water's not usually conducive to that, especially in the winter months. Those lakes can be pretty rough, so we like to stay over ground. I'm always excited to tell people that since our beginning in 1981, we have never had any safety issues whatsoever. We put a high priority on safety, and we have a perfect track record with successful flights. No one's ever been injured on a flight. So, and we have actually, I mentioned the humanitarian flights that we do. We actually just started with our first flight of a service dog a few weeks ago. We had a medical patient who was in need of a service dog. There was an organization that said, we'll get a service dog for you. The problem was they had to go pick the dog up, and the patient was not able to travel and get there. So they heard about us. They put in a request. And so we thought, well, let's put this out to our pilots and see if anybody wants it. the people in the office told me they had an endless list of pilots all jumping on saying, we want to fly the dog. And so one of the groups that I worked with in my service of hospitals was the Indiana Canine Support Network. And it is an organization that trains support dogs and then gets them to people who are in need of a service animal. So we're now working with them, and they said that a lot of their patients who need service dogs that they have trained are outside of the Indianapolis area. So it is frequently a problem getting the dogs to the patient. And so now we'll be able to fly service dogs to get them to the people in need. So just a wide array of services to help people with their medical challenges. Other questions?
That's incredible.
All right. Well, Cindy, thank you very much for having me with you today. I enjoyed meeting with the group. I am based out of Maumee, Ohio, just west of the Cleveland area, but Northern Ohio has been home to me for many years. I didn't always live here. I lived here in the late 70s, and I always knew I would get back to the Great Lakes area. And I'm delighted to have returned to this area and really ready and anxious to serve any chamber member I can.
Very good. Thank you. We really, really appreciate it.